All right, today we're stepping inside the operating room to explore one of the most complex procedures in all of surgery, the radical neck dissection. Now, this is so much more than just removing cancer. It's a high-stakes balancing act, a surgeon walking an anatomical tightrope between curing the patient and preserving their quality of life. So let's get into it. So here's how we're going to break it all down. First, we'll cover what this surgery actually is. Then we'll dive into the two biggest dangers, a literal minefield of nerves and the body's incredibly complex plumbing system. After that, we'll walk through the operation step by step, and we'll finish up by looking at that ultimate challenge, balancing the cure with the patient's future function. Okay, first things first. Before we can really appreciate just how intense this surgical tightrope is, we need to understand the fundamental goal. What is this operation actually trying to do? So what is a radical neck dissection? I mean, the name itself sounds pretty serious, right? And for good reason. This is a foundational and you could say a deliberately aggressive operation when it comes to head and neck cancer surgery. Okay, so in the simplest terms, the main goal is to get rid of the lymph nodes in the neck, because that's often where cancer likes to spread. But here's what makes it radical. It's not just the lymph nodes. To be absolutely sure they get all the cancer, surgeons also remove three other major structures: the big sternocleidomastoid muscle that lets you turn your head, the massive internal jugular vein that drains blood from the brain, and the spinal accessory nerve, which, as we're about to see, has a huge impact on a person's life. And really, this slide just says it all. This is the constant battle happening during the entire surgery. The number one goal is clear: get every last cancer cell out. But the challenge is just as huge. Do that without harming all the other critical structures packed into that tiny, crowded space in the neck. Which brings us to the first massive challenge. Seriously, if you picture the neck as a dense jungle, then the nerves are like an invisible minefield. The surgeon has to navigate it with absolute millimeter-perfect precision. These are the big five, the nerves that are always on the surgeon's mind. Each one of them controls something you do every single day without thinking about it: shrugging your shoulders, moving your tongue, speaking, even breathing. Now, in a radical neck dissection, one of these, the spinal accessory, is taken out on purpose. The rest, they have to be protected at all costs. And this table, this is what really brings it home. It translates that anatomical map into real human consequences. Damage the marginal mandibular nerve, and you get an asymmetrical smile. Hit the vagus nerve, and your voice goes hoarse. Nick the phrenic nerve down by the lungs, and you could end up breathless. Every single nerve has a name and a very, very real job. But of all these nerve issues, one is in a class of its own. Remember that spinal accessory nerve, the one that controls your main shoulder muscle? Well, it's removed as part of the radical surgery. So shoulder syndrome isn't just a risk, it's a guaranteed outcome that has to be managed. And this is what that looks like. Without the signal from the spinal accessory nerve, that big trapezius muscle just wastes away. It leads to constant pain, a very noticeable droop in the shoulder, and makes it incredibly hard to do simple things, like just reaching up to grab something from a shelf. It's a huge part of the price of the cure. This quote, taken right from the surgical guidelines, really drives the point home. While one major nerve is sacrificed by design, the surgeons are given strict instructions to protect the others, like this one that controls the lip. You know, they don't use a word like critical lightly in these documents. It just shows that the surgeon's mind is constantly split between attacking the cancer and delicately preserving everything else. Okay, so we've made it through the nerve minefield. Now let's talk about the second major challenge, controlling the body's plumbing. We're talking about the complex web of veins, arteries, and one very unique duct that runs right through the neck. 2, that's the number. It's the number of times a surgeon has to ligate or tie off that massive internal jugular vein. They tie it once at the bottom near the collarbone, and then again way up at the top near the skull, all before it can be safely removed. And the timing here is absolutely crucial. They tie off the vein at the bottom of the neck very early in the surgery. So why do they do that? It's actually a brilliant tactical move. By shutting down the main exit ramp for blood, they basically trap any cancer cells that might break loose during the operation, preventing them from escaping into the bloodstream and spreading around the body. So dealing with blood vessels is one thing, but there's another, much stranger fluid system in the neck. And when that system gets broken, it causes a very unique and very serious problem. It's called a chyle leak. Chyle is this milky fluid, basically lymphatic fluid mixed with digested fats. It travels all the way up from your gut in a big pipe called the thoracic duct, which plugs into your veins deep in the neck. If a surgeon accidentally nicks that duct, all that vital, nutrient-rich fluid spills out. That can lead to serious problems like malnutrition and infections. And here's the really wild part. This risk is completely lopsided. The major thoracic duct is only on the left side of your neck. So that one simple fact of anatomy means that a neck dissection on the left carries a high risk for this chyle leak, while the same surgery on the right side has a much, much lower risk. Pretty amazing. Okay, so now that we understand the nerves and the plumbing, let's actually trace the surgeon's path as they move through these incredibly critical areas. You can see the surgery follows a really logical path, almost like a guided tour around the neck. It starts low in step 1, where they divide that big SCM muscle and tie off the jugular vein, just like we talked about. Then the dissection moves to the back, clearing tissue along the trapezius muscle. That's the danger zone for those nerves. Step 3 takes them up high, near the jaw, where they have to find the nerve that controls your tongue. And finally, in step 4, they clear out the area under the jaw, taking a salivary gland and completing this one big block of tissue that gets sent off to the lab. And all of that brings us right back to our central theme, back to the surgeon's ultimate challenge, that constant moment-to-moment balancing act between two goals that are both competing and yet equally important. This is the absolute heart of the entire operation. Every single move a surgeon makes with their instruments carries this incredible weight. Do I cut a little wider to make sure I get all the cancer, even if it means risking the nerve that lets someone speak clearly? It's a nonstop series of tiny decisions that have huge consequences for a person's life. So it's never a case of get the cancer out at all costs. You can really think of it like this chart shows, a 50-50 split in the surgeon's mind. A truly successful surgery isn't just one where the patient is cancer-free. It's one where that patient can go on to live a full, functional, happy life afterward. And, that balancing act doesn't end when the patient is wheeled out of the operating room. This final quote from the protocol makes that crystal clear, because everyone knows the functional cost of the cure, that shoulder syndrome. Aggressive mandatory physical therapy is baked into the plan from day one. The cure and its consequences are managed hand in hand. Which leaves us with this final, really profound question. The radical neck dissection is an incredible tool that saves countless lives, but it absolutely comes at a price. It forces all of us, doctors and patients, to think not just about if we can cure someone, but what that cure actually looks like, and to ask ourselves, how do we truly weigh the price of a life